The following portion of Bloom is sponsored by Gulfside Healthcare Services.
Quality healthcare means better patient outcomes. Gulfside Hospice is serious about this and compliance with the best practices so patients and families can feel secure. Here with more is the Vice President of Compliance of Quality and Health Information Management, Megan Weaver, and the Director of Quality and Compliance, Kristen Gracz. Thank you so much for being here, ladies.
Yes, thank you for having us.
So I know Gulfside really does focus on quality. How do they do that?
Well, the hallmark of quality is providing patient and family-centered care. This is a key component of our core values here at Gulfside. What we do is provide the care that the patient needs by the team member, when the patient needs it and where they need it. And we're able to do this through our 24/7 triage phone line, through our inpatient care centers, and through our enhanced staffing model in the evenings. We strive for excellence here at Gulfside. We strive for excellence through process improvements, and some of the initiatives that we've worked on have been able to help patients with some of their key issues, such as medication management, and getting the patient urgent care when they need it.
And when you hear that Gulfside has accreditation, what does that mean?
So accreditation means that we go above and beyond in our quality initiatives as well as compliance. So we make a choice to be accredited. We don't have to be. So that means that we are opting for that higher level of care, those higher standards to comply with, and welcoming in additional surveyors to make sure that we're keeping that promise.
Yeah, whenever some company or a nonprofit goes for accreditation, you know that quality really matters. Now, what are some of the key standards that patients and families should keep in mind when they're considering hospice services?
So as I alluded to before, that 24/7 around-the-clock care is very important. Hospice is not a 9-to-5 business, and we know that some of those scary moments can occur in the evening and late hours. So making sure that you have a hospice that's able to provide you those services is a key component.
And a lot of times people think of hospice as the immediate end of life, but so much goes into it leading up to that. And
Yes.
you know, a lot of families don't realize, but hospice is like your saving grace. I found that out firsthand with both of my parents.
Absolutely. Hospice is there for the patient and the family. There is no set time frame for when somebody might come to that actual end of life. So hospice is there to help through those days, weeks, months, even years, whatever it might be for the individual patient.
And even the emotional support. I mean, you get a lot of medical guidance, but the emotional support is just indescribable because you just feel so lost and alone when you're trying to navigate the healthcare system and you're, you know, beside the person that you love, and it can really become overwhelming. And that's where Gulfside Hospice comes into play as well.
Absolutely. Gulfside for hospice, you have a team of clinicians. It's not just a nurse. It's not just a doctor prescribing orders. You have a social worker, a chaplain, volunteer services. There's bereavement for post-hospice care for those caregivers who were taking care of the patient alongside the team. And so it really is a full benefit and something that can really be a saving grace, like you said, at the end of life.
Yeah, and you can actually see in the patient, like getting out of that emergency care where there's so much tension into hospice care. Actually, for many studies show extends the life in a peaceful way. So thank you guys so much for joining us today.
Thank you for having us.
All right, for more information about Gulfside Hospice and other services available, visit gulfside.org or call 800-561-4883, 7 days a week, 24 hours a day. Bloom will be right back.
The preceding portion of Bloom was sponsored by Gulfside Healthcare Services.